Hello, my name is Troy Roach. I'm a citizen scientist studying low-dose nicotine patches for long COVID, ME/CFS, and other diseases. It has a lot of promise for other diseases as well. And today I'm interviewing Dr. Hirsch. Is that pronounced correctly?
You did good.
Yes. So he is a doctor who actually specializes in treating patients with long COVID, post-viral diseases, etc. And he has his own program. And he actually has used nicotine patches with his patients. So we're going to get information from him as a clinician, how he uses it with his patients, and then his general protocol on how to get better if you do have long COVID or similar disease. But of course, before we start, just to make all the lawyers happy, this is not medical advice, not from me, not from Dr. Hirsch, even though he is a doctor. He's not giving you medical advice. If you do want medical advice from him, then you can find his contact information in the show notes below, and then you can get information from him, okay? So this is just for informational purposes for other clinicians and for patients to know what to do and what to expect. Okay, so I guess we can start off. So Dr. Hirsch, maybe you can start off by explaining how you got into long COVID treatment.
Sure. So long story short, I had chronic fatigue syndrome in 2010, and it lasted for about 5 years and just about destroyed my life, destroyed my business, my relationships. It was very challenging for me. I couldn't play with my daughter, who was very young at the time. I just had to lie on the couch. And so I had chronic fatigue syndrome. And I realized after napping underneath my desk for what felt like the 1,000th day in a row is that I just needed to find the causes. So I went through a process and I found the toxic 5 causes that we're going to talk about today. And I went through one at a time. And as I addressed each one of those, I just kept getting better and better. So then I was already practicing functional medicine, which is a combination of conventional medicine and natural medicine or integrative medicine. And I started helping people. I wrote a book about it. And so my focus became chronic fatigue and chronic fatigue syndrome. So then in 2020, I was very uniquely positioned to address long COVID as well, because it's basically chronic fatigue syndrome, except with a different trigger. And that's what I found is that as we started to be available to these people when they would reach out to us and we started helping them, I found that we were having lots of success because it was more than just the spike protein that was going on. It was this other toxic 5 that we're going to talk about. And then I started to incorporate, once I read some of the research on nicotine patches, I started to incorporate that. And that's what we're going to talk about today also.
Okay, good. Well, just one clarification. You said that long COVID is similar to ME/CFS, but there are subgroups who have long COVID who don't experience PEM. So those people wouldn't, I guess, be considered ME/CFS type.
Correct. Yeah. So ME/CFS, is obviously the diagnosis. Depending on whether or not you're outside the U.S. or inside the U.S., the criteria is going to be a little bit different. But in terms of having the same causes, what I have found is that they all have the toxic 5, which is a combination of heavy metals, chemicals, molds, infections, including the spike protein, and nervous system dysfunction. And so it really just depends on the location of the toxic 5 in the body that determines the symptoms that you have. So if you don't have fatigue or post-exertional malaise, it means that the mitochondria has not been negatively affected by the spike protein, for example. And so, if it gets into, if you're having loss of taste and smell, then you know that, in the olfactory nerve that the spike protein has taken up shop. And if you have muscle pain, if you have cognitive dysfunction, it really just depends on where in the body the spike protein, in this case, and some of these other toxins and infections have taken up shop.
Mm-hmm. Okay. So maybe first you can go through what type of protocols you use with nicotine patches with your patients, and then maybe some cases of how things went well or didn't.
Absolutely. Yeah. So we start people generally off with the 7 milligram patch. If they have a hard time tolerating it, then we drop it down to half a patch. And we'll usually start them off with, we'll do a 2-week round, so 14 days, wearing it for 24 hours at a time, which was from some of the initial research. Not everybody can, and then we vary things based on people's reactions. So if they have any sort of negative reactions, we're looking for what I call their Goldilocks dose. So basically the dose that is going to provide the benefits without the negative reaction. though the negative reaction isn't all bad, which we can kind of talk about in a little bit. So if they're putting on a patch and they're changing it every 24 hours and they do that for 2 weeks, then we assess where they're at. If they have noticed a benefit, we have them stop to kind of give the body a little bit of a break and the receptors a little bit of a break and see whether or not the benefits persist. If the benefits do not persist, so if some of those symptoms have improved and then they come back, then we'll go ahead and do another round and see how they are after 14 days. At some point, we may, if we're not noticing any sort of difference at all, we will increase them generally to 14 milligram patches and see how they do in that realm. But usually we're seeing results, in about 50% of people with the 7 milligram patches. Now, if they feel badly just coming out of the gate, then we'll go ahead and we'll have them do half a patch, or we'll have them do a patch every other day, or we'll have them do a patch and take it off in the evening so that they're just wearing it for about 12 hours. So that answers, I think, the first part of the question in terms of kind of like how we're traditionally using the nicotine patches. I would
Mhm.
say that I also have found that it's helpful to have people use the nicotine patches a little bit further in our protocol. And part of that is the fact that when you have people on fibrinolytic enzymes like nattokinase or lumbrokinase, where you're digesting fragments of the spike protein, it can be helpful when the nicotine patch binds to the receptor and kicks off the spike protein to have something in the blood that is going to digest that spike protein. Because sometimes when you feel worse when you're doing the nicotine patch, sometimes it's because you're releasing the spike protein and then the immune system is seeing it and reacting to it and you get inflammation. So if you have something like the fibrinolytic enzymes to digest the spike protein, oftentimes you can decrease some of the negative reactions that you're having.
Okay. Actually, Dr. Leitzke now doesn't suggest using breaks. If people are responding to the patch, he suggests that they stay on it for quite a while until they feel fairly stable, that they've advanced and their advancements are not, they're not getting better and better yet. Also because some people, maybe they'll stop after 2 weeks or a month or whatever, and then they'll feel horrible because they thought they had to take a break, etc.
Mm-hmm.
So in general, we're telling people not to take a break unless they feel they need to take the break, because sometimes they'll go backwards, or after the break, they feel that they don't have the same effect from the patch, etc. What do you think about?
Yeah, that's reasonable. Yeah, there are definitely people in our program who find that they're better on the patch. And so if you're noticing an improvement, then we just, and every time you come off of the patch, you feel worse, we just
Mhm.
keep you on the patch.
Yeah, okay.
Yeah, so I
Um,
agree with that. And then do you want me to go into
yeah.
some cases?
Well, I just wanted to mention one thing quickly. Now, I mean, in the beginning, we didn't have anything that we suggested along with the nicotine patch. But as time has gone on, I've seen some things which are safe to do, which seem to help. One is making sure people are hydrated with electrolytes. One person recently suggested using oral hydration solution, or oral rehydration solution, ORS, for like in a half-hour break, in a half hour time in the morning, to make sure that their blood volume was up, etc. And the other thing we do is we suggest lymphatic drainage. There's doubt about whether the spike that is being released is actually in the receptors. It could be that the increased blood flow through the lymphatic system is pushing out debris from the lymphatic system, and that's what's causing the Herx reaction. So now in the next study, for example, we're going to have people do lymphatic drainage twice a day, just a few minutes each time, for 2 weeks before they actually start the patch, maybe to help get some of that out and reduce the Herx reaction. And then while they're on the patch, to continue doing it and staying hydrated, etc. I think that those things are, I guess, fairly safe recommendations for most people. So that's why I recommend them. And they're, for the most part, free or very cheap to do as well. What do you think about those adjunct
Yeah,
things?
I think those are great ideas. So for everybody who goes through our program, we require them to be consuming 3 liters of filtered water a day.
Hmm.
And then we add in either sea salt or some sort of electrolyte solution.
Mhm.
in order to make sure that they're staying hydrated. Part of the stress of having the spike protein, long COVID, chronic fatigue syndrome, the toxic 5 is that it compromises your adrenal glands. Your adrenal glands are little triangular glands. They sit on top of the kidneys. They produce cortisol, among other hormones, and they're responsible for managing stress in the body,
Mhm.
as well as blood pressure. And so consequently, if your adrenals aren't functioning well, then you are going to have low blood pressure and you're not going to be perfusing your brain. So most of the people that we work with have a blood pressure that's lower than 110 systolic. So that's the top number. And so consequently, by having fluids, incredibly helpful, but you also need to be consuming, like you said, the electrolytes, sea salt, in order to be able to make sure that I say that the water sticks to your ribs, so to speak, or that you're able to hold on to your water. Otherwise,
Mhm.
you're urinating it out.
Yeah.
And when you hold on to your water, you increase your blood pressure. It increases blood flow to your brain, which just makes you feel better. And it makes it easier to stand,
Mhm.
because a lot of these people, they got post-exertional malaise or they've got POTS, where when you go from a sitting to a standing position, you feel worse. And it's because the body's having a hard time regulating your blood pressure. So if you've got high
Mhm.
blood pressure, you want to monitor this. But I definitely agree with that. And consuming 3 liters of water a day is essential whenever you're trying to get anything out of the body. So
Mhm.
that's going to be whether it's heavy metals, chemicals, molds, infections, like all of those things that we go through in our program need to be supported by consuming the 3 liters of water a day. So I absolutely agree. And then I
Mhm.
absolutely agree also with the lymphatic drainage. So step 3 of our 4-step process that we can talk about starts opening up the liver pathways for exiting toxins and infections out of the body. So this is liver and kidney and lymph and neurolymph, or the lymphatic system that's in the brain, and gallbladder and intestines. So we find that all those pathways really need to be open in order to make it easier to get rid of the toxic 5, including the spike protein, out of the body. And so we have some manual lymphatic drainage practices. There's also some herbs that we use in order to open up these different pathways. It's really essential to make sure that you mitigate the Herxheimer reaction or a die-off reaction as you're trying to remove these toxins and infections out of the body.
Yeah. Um, so what cases do you find more interesting to talk about
Yeah.
from suppression?
So, I mean, we've had so many people go through the process. I think that, I mean, let's call her Cindy. She's in Australia, and she tried the nicotine patch, and 7 milligrams was too strong for her. So then we recommended that she goes to 3.5. So then she was taking 3.5 every day, and she did that for 2 weeks. Didn't really notice anything. And then she increased up to 7 milligrams. She started to feel worse after doing that for several days. So then we did 7 milligrams every other day. And that seemed to work for a while. We also experimented with 7 milligrams, not for 24 hours, but stopping before she went to bed. And that's actually seemed to be her kind of like ideal dose, where she did have an improvement in cognitive function. Um, and then she also had some improvement in her energy and less crashes during the day. So that was really helpful for her. The other thing that was really interesting in her case was that she had continuous improvement. So, when she stopped after 2 weeks and she found some symptoms coming back, then she stayed on it, and she's on it continuously now, on the 7 milligrams taken just for the 12 hours during the day, but not at night. But she was finding that she was continuing to have improvement as she was also addressing some of these other things, the other rest of the toxic 5, as we're moving through the process. And
Mhm.
part of that is the fact that when you don't feel well, your body's in fight or flight or freeze, basically the sympathetically stimulated. And so we want the body to be more in the parasympathetic. And so the main neurotransmitter in the parasympathetic nervous system, which is rest, digest, relax, and heal, is acetylcholine. And nicotine, as you know, but hopefully these people listening will learn this right now, is that nicotine binds preferentially to acetylcholine receptors. So that even though it's called an acetylcholine receptor, nicotine actually has preference to that receptor more than acetylcholine does, which is really brilliant and beautiful because the more that we can stimulate that acetylcholine receptor, the faster people can get better. So it's just been a really nice adjunct as we're moving through this process. So I would say that's one case study. We've also had people who are very sensitive, some people who've got like mast cell activation syndrome, who've had to take an eighth of a patch or even a quarter of a patch, or even switch to the gum or the lozenge and taking a piece of that in order to be able to get some of the benefits of the nicotine without having in a way that's tolerant for them. And so, like so many things, it's all about finding the Goldilocks dose or the ideal dose for people to be able to take to be able to get the benefits.
Okay. I've seen people that are on 0.5 milligram a day, which to me just sounds crazy. I mean, it's like such a small dose over a day, but they're like, that's their perfect dose and they're benefiting and feeling much better. I was like, okay, great. Believe the patient.
Yeah, and so much of that has to do with their total body burden. So we find that the more of the toxic five, the more heavy metals, chemicals, molds, infections, and nervous system dysfunction that people have in their bodies, the harder it is for them to tolerate things in general, and that includes nicotine.
So what other negative effects have you seen from people?
So, I mean, there's been a number of different symptoms when they take too much, so whether it's a half a patch or a full patch or a quarter of a patch or whatever, if you take too much, you're going to feel worse potentially. And so that can be from either deposing the spike protein off the receptor site. It can be reaction to the nicotine itself acting in a different part of the body, but it can be almost any symptom. As we know, there's over 250 different symptoms that can be caused by the COVID virus or the spike protein. And so in general, you can have any one of those. So it can be cognitive dysfunction or brain fog. It can be fatigue. It can be body pain. It can be lightheadedness. That's a very common one that we see. I've seen people have atrial fibrillation or irregular heart rhythms or spike protein, myositis or inflammation, pericarditis, inflammation about the heart muscle. There's all sorts of different places that you can have side effects. So you definitely want to be under the guidance of somebody who you can have in your back pocket to be able to ask questions as you're kind of moving through this process.
The atrial fibrillation, I've seen that a couple times in comments on the Facebook group. Not very often, but I've seen it. What do you normally tell people in those cases?
You mean from the side effect or actually? So I've seen both. I've seen, side effects of having palpitations, which go away when you stop the nicotine patch. But then also atrial fibrillation can be caused by the COVID virus or the spike protein. And so in those cases, people improve when we have removed the spike protein, the COVID. And big picture, people are always asking, like, why me? Like, why am I one of the 36% or so of people who get COVID and then end up with persistent symptoms of COVID? And I tell people that the stage was already set with the toxic five. When you have an intact and functional immune system and you get exposed to a virus like COVID or the spike protein, the immune system will get rid of it. You'll have some sort of reaction, the immune system, you'll have a fever, cough, whatever. You'll end up getting rid of it and you'll go back to baseline. The challenge becomes when the immune system is distracted by the toxic five, by the heavy metals, chemicals, molds, etc., that then the spike protein, the virus can come into the body, take up shop, and end up causing all the inflammation, which results in your symptoms. So, part of our process is that we see a lot of people who have tried to go directly at the spike protein and they haven't been successful. And so then they come to us so that we can release the immune system by removing the toxic five so that then you can really get rid of the spike protein completely.
There's a couple benefits that I've seen that weren't expected. For example, people with diabetes who are checking their blood sugar regularly and using insulin, many of them say that their blood sugar and insulin needs go down about 10% when they're on the nicotine patch, but only while they're on it. It's not like a cure type of thing. It's just while they're on it, it reduces their blood sugar. Have you seen any cases of people mentioning lower blood sugar while they're on the patch?
I mean, we're doing a number of different things at the same time, so it's a little bit hard to say, but we generally see significant improvements in blood sugar as people go through our program, not just from changing their diets, but changing the stress on the body from the toxic 5, including the spike protein that ends up causing hormone dysfunction. So because the stress will cause adrenal gland issues, and cortisol is the main adrenal gland hormone, and cortisol manages insulin. So when adrenals are functioning properly, because you've decreased the stress of removing the toxic 5, blood sugar is significantly improved. So I would imagine my theory on why this is happening for folks is because the nicotine patch is decreasing the amount of spike protein in the body, and consequently that decreases the stress, that improves adrenal function and cortisol function, and that improves the management of insulin and blood sugars.
And I've also seen a lot of cases, quite common to see people mention that it lowers pain, and especially if they put the patch on the area where they have pain, like on their back or their hand or whatever, that they see benefits within 3 to 5 days. Even one case that I'm writing up a case study on a woman that was 76 years old, and she had debilitating chronic regional pain syndrome in her hand, where she couldn't even make a fist with her hand. And in the past, she was using fentanyl patches because morphine wasn't enough. And then with a 7 milligram patch, after a few days, the pain went down to like minimal, like a 2 out of 10.
Amazing.
So that's, I don't know, I don't know if you've seen cases like that where they've mentioned pain going down.
I haven't seen that yet, but I was so impressed by the research that I now have everybody who goes through my program, whether they have long COVID or chronic fatigue syndrome, go through a nicotine patch protocol. So I do believe in the value, and potentially in that case, it could be just from the activity of the nicotine on the acetylcholine receptors, switching somebody into parasympathetic, and that can be, affecting substance P and the pain pathway. But yeah, there's lots of potential benefits.
Yeah, Harvey. So your program, maybe you can mention the basic protocol that you follow with
Sure.
patients, so patients could get to know you better.
Sure. So we have a 4-step process, and I call the people we work with clients, because even though I'm an MD, I operate online as a health coach. So we work with people across the world right now. About 10% of everybody is outside of the United States. So we've got a number of people in the European Union, UK, Australia, New Zealand, Canada, in addition to people in the United States. So the first step that we take is to make sure that we're addressing all of the causes that somebody has. And so when you join the program, you fill out a form. I provide you with a plan specific to you that is going to walk you through a process of addressing all of the causes that you have. And it's not just the causes that you have found on laboratory tests. It's also causes that we can determine based on your history and your symptoms. And then we always want to make sure that our program is the last one that people need, that you can get to the finish line. And so we actually address all of the toxic 5 without testing. So this means we're going to address the heavy metals, the chemicals, the molds, the infections, and the nervous system dysfunction that you have in your body, whether or not you have any tests to show that you have them or not. And the reason why is because the testing for these things is highly imperfect. I've been fooled in the last decade of doing this work numerous times, and I don't want to be fooled anymore. And I know that the fastest way to get people better is to address all of these causes, because this is 99% of all the potential causes, and it's not going to cost you more money. It's actually going to cost you less, and it's going to save you time if you actually just treat them. So that's what we do in step 1. Make sure we're addressing all the causes you have. Step 2, we start by replacing the deficiencies that are present. And so this is going to be deficiencies in hormones like the adrenal gland I mentioned, thyroid, sex hormones, deficiencies in mitochondria, which produces 70% of all of our energy and is found in every cell in the body except for red blood cells, deficiencies in vitamins and minerals, deficiencies in lifestyle habits, so making sure that you're drinking enough water, getting enough sleep, getting enough movement, and eating the right foods, and deficiencies in mindset. So that's what we do in step 2. And this whole process is about removing the toxic 5 and the spike protein in step 4. But we go through this process in order to make sure that you are ready for step 4, and the body's prepared for it. So in step 2, we're making the body more resilient just by increasing all of these or optimizing all of these different deficiencies. You're just going to function better. You're going to have less pain, less inflammation, less fatigue, more cognitive function. And then step 3 is opening up the exit pathways that I mentioned before: the liver, the kidney, the lymph, the neural lymph, the gallbladder, the intestine, all these paths in which we get toxins or crap out of the body. And then we go into step 4, and that's where people spend the majority of their time removing the toxic 5, retraining their nervous system, getting rid of the toxins and infections.
Okay.
I tell people it takes at least 12 months,
What are
and
the most common medications that you suggest that they use, or
so
are
I
you
don't, I don't,
all
pres-
supplements?
I don't prescribe anymore. I don't recommend any medication. Everything that we do is natural. For people outside of the US, we use iHerb, which can be found internationally. And so it's all supplements, it's tinctures. That is, we're increasing by a drop at a time. We're introducing a new supplement every 4 days or so, making a change in the protocol. So we know exactly what's happening at every point in the process. And when you start to increase tinctures that are addressing, let's say, heavy metals or so, and you start to feel worse, we know that heavy metals are a problem for you. And we can increase some step 3 support to decrease the Herxheimer reaction, to help you go through this process as gracefully as possible.
That's good. So it usually takes, I guess, at least a year, you said, to kind of go through all of the steps. I've noticed that most of the patients are anxious to get healthy. I often see these comments like, I'm going to start the nicotine patch because I have some major life change in 7 days, so I want to be ready for it. I'm just like, 7 days? That's too ambitious.
Yeah, I wish it could be faster. I tell people I want you better yesterday, but
Yeah.
and most people come to see me after they have had their symptoms for a number of years, because people just aren't ready and willing to commit to a year-long process, and
Uh-huh.
the people that I see, I mean, a lot of people can get significantly better with doing the nicotine patch. And so, that's why I do a lot of talking on YouTube and whatnot, and interviews like this, talking about the nicotine patches as, this is a great potential first step to do. Go join Troy's group and, kind of get that knowledge and go ahead and do that protocol. And then if you're not getting the results that you want after that, that's when people really should come and see me, so we can figure out what else is going on.
Yeah. I mean, I think the original research from Dr. Leitzke, where there was only 4 cases and he was managing them, and most of them were short-term cases in those case studies. So with 1 week of 7 milligrams, that was enough for them. Whereas I see that most people now have been sick for years,
Mhm.
and 1 week or 1 month is usually not enough. Every once in a while, there'd be somebody like, oh, I tried it for a week and now I'm back to normal and doing everything I used to do. And I was like, oh,
Right.
great. But it's not the norm for people to be to see that. Some people see pretty big benefits. They increase their baseline from 60 to 70, or from, 50 to 75 or whatever, in a short period of time. Almost everybody, when they get those huge bumps, they forget to pace,
Right.
and then they'll crash. And then they have to kind of like start over again, etc. Pacing is difficult, especially when you start getting some energy back.
Right. And that's why in our process in step 2, we're really, by supporting all those deficiencies, it really helps you with that new level of energy that you end up having.
Some people who don't see benefits with the nicotine patch, they've tried it for a month or 2 months and they're just not seeing benefits. We usually suggest to go work on gut health in general, changing their diet or supplementation, or like the research from Tom Bunker on autophagy, doing short fasts, etc., those types of things before trying the nicotine patch again. One doctor I work with said that he tried the nicotine patch when the patient was at about 20%, and it didn't work for them. But then when they got up to like 70%, they tried it again and it was like fantastic. It changed their life. So even if it doesn't work for somebody today, it might help in a month or a year or whenever.
Yeah, that's a really important concept, because we do the same thing in our program, where if people are saying, I'm not noticing anything, be like, okay, that's fine, we'll come back to it. once you're a couple months into it, just because your body's going to be different at that time, the terrain is going to be different. It's very possible that that's going to be the next step in your healing journey, or it's going to be that additional support that's going to put you over the edge to have those benefits.
Yeah. Okay, great. Well, I want to be respectful of your time because I'm sure you have plenty of patients waiting for you.
Happy to be here.
So what do you have any like final comments that you would like to leave for people?
Well, I think, one thing that we didn't talk about was that there are some people who are hesitant to do nicotine just because of the connotation or the association with cigarettes, right? And so it's important to remember that the toxicity from cigarettes and the cancer and whatnot really comes from the other components of the cigarette. The nicotine is the dependency part of it or the addiction, but the dosing that's being recommended that we're talking about today, 3.5, 7 milligrams, has never been shown to cause dependency. Now, you can
Mm.
correct me if I'm wrong, but that's my understanding of the literature. Do you agree?
Yeah. Yeah, I agree that there's not a risk of addiction as it's defined medically, but like anything that you use that helps you, if you stop using it, then you'd be like, I missed that. Like maybe like coffee or something. If you're used to having coffee and all of a sudden you stop having it, then you don't feel so good. And also I've noticed that there's a big connection between neurodiversity and long COVID and ME/CFS because I started noticing that a lot of the people in my research had ADHD and autism. And then I found about HSPs, the highly sensitive people, which is a much broader definition of neurodiversity because it covers 15 to 20% of the population. And then when I asked people in informal surveys whether they had HSP or other neurodiversity, more than 90% said yes. Whereas if you asked the general population, then maximum 15 to 20% would say yes. So, and there's also seems to be a increased benefit of nicotine for those groups. So I think a lot of people, maybe they will see benefits for their health from it, but then I think a lot of people will use it just as kind of a general life aid going forward as well. So a lot of people are like, okay, well, I'm not stopping anymore because this is so helpful for ADHD or autism
Right.
or just
Yeah, and
general
and
life.
that doesn't surprise me because, my lens is that those conditions are really all about the toxic five. It's the total body burden and these toxins and infections that end up affecting your immune system, your nervous system, etc., that consequently make it hard for you to function in society and have these symptoms. And so, my approach is to remove the toxic five from the body, and then we see improvement in those things. And I see that, the nicotine patch and nicotine support can be a significant part of that. So I so
Yeah.
appreciate the work that you're doing. So I guess the last thing that I would also say, is that it's important to continue to move through your health journey. So, do the nicotine patch protocol, get as the best that you can with that. If you need additional support, we're here for you. You can find us at energymdmethod.com, or you can do a free fatigue assessment at myfatiguescore.com. And you can come and see if we're a good fit to work together to help you get to the finish line.
Well, thanks a lot for your time and for sharing your experience with everybody, not just for patients, but for other clinicians who might want to use nicotine patches with their patients. So that'd be very helpful. So thanks for joining us today. Remember to take care of yourself. And if you can, take care of somebody else too. So that's it for today. Bye.